our executive team has visibility to this. Our executive team meets twice a week for 2 hours in the morning. 7 o'clock in the morning, I might add, okay, right? Which is nothing new to healthcare, but big change for me, right? So 7 to 9, 2 days a week. And once a month, we have somebody come in and, that is doing good work around engagement. So a leader or a work group will come in and talk about what they're doing around a best practice. We do a pulse survey in addition to our annual survey, and that pulse survey is an internal survey, and it only pulses on people's perception on how well people are managing the plan that they're developing. So it's not about how you're feeling, but it's really about management accountability. Are you doing the thing as a leader to actually drive engagement? People need some coaching. So the HR function actually worked hard at auditing these plans, quality checking these plans, and coaching leaders on how to develop plans around the Gallup survey. It was very, very successful and very, very well received. And that one thing, I think, really demonstrated that this wasn't a fad. It was something that we were going to stick with, and it was key to moving us forward. That one thing, starting with a great plan, really moves the organization. Oh, and by the way, we looked at the bottom quartile managers, gave them some special coaching over a couple of years, moved some managers out, put some people on performance improvement plans, and refreshed that part of the organization. So here are some of the results that we've got. This is a grand mean score progress over the last 5 years, and as you can see that we've had some very significant growth. And according to Gallup, we're one of their best practice organizations. This is going to take some time. I told them, I said, when I mentioned the word Exxon Mobil to you, what do you think about? Oily ducks, right? In Alaska, right? Do you know that was over 20 years ago? And Exxon Mobil is now the greenest oil company on the planet. So I have Exxon Mobil stock, so you can buy it. But really, it just takes time to change people's perceptions. You have to do the right things, but you got to do them over time to really mobilize people and get them to really believe, and you got to earn their trust that way. And you can see, 2009, we were at 2.58 to 1, and we're now at over 10 to 1, and we've cut our highly actively disengaged group of people almost in half, and we probably won't get much lower than 6%. So this has had a major impact on our business, and this again tracks some of our additional way we look at our progress. That green line is the work group level scores, which means it takes nursing and IT and all the subgroups and compares that across subgroups across their entire database. Right, the top red line is just taking the hospital conglomerate as a whole and averaging it all together. And as you can see, the tougher measurement is the work group level, and that's what we use to plan, because you make progress along those lines. But as a healthcare system, we're actually in the 87th percentile. I like to talk about the 61st because it keeps people challenged. We have not made Fortune's one of the best places to work. But we have started to get some recognition locally and nationally with Diversity Inc. and as well as the top 150 workforce. So again, this is not about winning awards, but it is about creating an environment which is the best thing for our patients.